Norman C. Hurns, MALPCS, NCC, CCTP, brings a wealth of knowledge and experience as a veteran, K-12 counselor, college professor, and therapist in private practice. In this session, Mr. Hurns will help students explore the many pathways to a meaningful career in mental health, from school counseling and psychology to social work, therapy, and beyond. Through real stories and interactive discussion, he'll show how compassion and curiosity can grow into a lifelong impact, helping others. Welcome, Norman.
Thanks for the introduction. I really appreciate it. I just want to emphasize with everyone just a multitude of ways in which you can leverage the degree or the pathway within mental health. That's one thing that I found out, and I'll share some more stuff with you as well as we go through this journey. Currently, I am a private practice, doing some contract work with counseling. And then also, I was called back to my former high school to be the department chair to the rest of the year because somebody had to leave. So that was an option as well. And I am teaching online currently a career course, first year experience for students. And that's something typically, as you guys know, if you're high school students, that you're going to have the academic piece, the post-secondary piece, and of course, the mental health aspect as well. So I really like those different pathways and still able to touch them outside of a K through 12 setting. All right, just a couple things in my transition that I think is important as you try and figure out what you want to do. And developmentally, it's not even appropriate to be able to pick that what you want to do that soon, right? But we continue to push and get exposure to some different things, and this is one of them. You know, all you can do is try and learn as much as you can to try to come up with the best decision. But these things sometimes happen, you know, in respects to time. I started off as a history major, wanting to become a lawyer and just reflecting on the impact that I can have, which I thought I could have in being a lawyer, to being in education, because it was such a positive thing for me as going through K through 12 systems. So I eventually just got my liberal arts degree so I can get started, and got my master's degree in secondary education and became a teacher. And then around 2010, just reflecting on the impact that I was having within the classroom, there was a lot of other stuff happening and going on during that time period. And students and families were needing more than just learning about world history and government. So I went back to school and eventually became a counselor in 2013 at my old high school I was at. So that kind of worked out perfectly for me in that respect. So that's how I got to kind of where I'm at now. And I just finished up my doctorate degree in educational leadership with a focus on counseling in December 2025. All righty. So one of the reasons why the field is a important place and things you need to know, whatever you're looking for, is it a good field to go into, and what does it look like, you know, down the road and in respects to jobs, etc. So 1 in 5 U.S. adults live in mental health condition. So that's 57.8 million people. 50% of all mental illness begins by the age of 14. It doesn't say that it's debilitating or anything like that, but in respects to mental health illnesses and things that are impacting people, to what degree might be different for those individuals. And 160 million Americans in the mental health professional shortage areas. So there needs to be a shifting of the workforce to address those needs. And 40% of adults who need mental health care never receive it. So they're not addressing it, they're not engaging it. So even the outreach and the conversations around mental health, there's even a spot for that. We need to start talking about it in a way which becomes more acceptable. Or who are those people doing that? So there's so many different ways to kind of do a, somewhat of a dive into the mental health profession. And then substance use counselors, 22% is going to be an increase. They're looking for an increase through 2032. Marriage and family, 16%. I thought this was relatively low, and that's reassuring. But usually, you know, marriage and divorce and things like that, the impact have been a little bit higher over the years. And 11% school and career counselor, and the dynamics are changing, across the country in respects to how things are being accessed, and what is the strength of those particular schools that you're attending and what the focus needs to be. All right. So they need 250,000 additional mental health workers right now. So you can imagine as the years go on, there's going to be more of an impact and more things happening. So in respects to a place where there's jobs are there, now whether you want to do it or not, that's a whole other question, right? But there is an opportunity that exists in those areas. Also, I was surprisingly, it didn't speak to, I know it spoke to adults, but our population with the baby boomers is the largest generation, and they continue, of course, to get older, and there are going to be some needs there, whether it's physical mental health or possibly, mental health, or it might be physical health. But that's another looming group of people that can impact those particular numbers. And it's just a career pathway at a glance. I'm going to take a look at that so you guys can see opportunities and whether it's financial and what does it look like and what are the options that exist for those particular jobs. All right, this is level one. This is minimal training. And I think you mentioned about the peer support specialist. You could be a crisis hotline counselor, mental health aide, or direct care. So this is with no degree. I'm sure there's some training that goes along with that. You can see the amount of money that's on average. And of course, we know that's going to change that's going to be different depending on, what part of the country you're living in and things of that nature in respects to the amount of money. But this is just a range for you. Okay. And it kind of breaks down, shared lived experiences in mental health, provide immediate phone and tech support for those crisis hotlines. I know I'm a veteran, and that is a big thing for us, the suicide hotline for veterans, and for veterans to get, help, right away. And the same thing, I think, for, high school students, we have, lines in which they can call as well if there's a crisis taking place. So being somebody there and being able to navigate people through those tricky situations. Did a mental health aid, direct care, assist clients with daily living skills, residential and patient settings. I was touring a assisted living a place, and they had people that were contracted to be available for residents. This facility I think it was over 2,000 people in this facility here in Michigan. Then that could be a group home, you could be in a hospital, you could be in residential programs, as well. And then you have a level 2, which is certification. So certified alcohol and drug counselor. Again, this is something 6 months to 2 years. I know a lot of times people want to get directly into that workforce and what can get you there and get some experience and really trying to define where do you want to be. And I'll just digress for a second. One of the reasons why I thought about social work and I thought about school counseling. And what school counseling offered with the licensure is the opportunity to be K through 12. So I can place myself in elementary school, middle school, or a high school. And then also I was able to, it's the designation needed for college. Now that's transitioning a little bit, but at a minimum, they want you to be an LPC in a lot of mental health situations at in higher ed. So it gave me the chance to go in higher ed, and I've worked at Henry Ford College, Oakland Community College, and Macomb Community College as a counselor, doing academic, doing mental health, and doing career. But think about when you're going through your career path, whatever it is, how flexible is it? What else can you do? And how can you monetize what's taking place in those particular degree level, whatever level you're on? So that's just something to think about. And then the opportunity to teach in higher ed as well. All right. Just imagine a teacher usually they tutor, do something like that. Or it may be in charge of testing, things of that nature. But how can you leverage what you have to do more than just one thing? So there's something to think about. So that's our level 2 certification to get into the professional field. All right. Anybody have any questions so far?
Request to speak.
Oh, okay. Okay. Oh, thank you so much for saying that. Okay, thank you so much. The associate's degree. So you're talking about a 2-year degree. Psychiatric technician, human services technician, substance use counselor, I've seen this more and more, that substance abuse, and I think that I showed on the other slide, but it's been something that has been pervasive as people, deal with life, in different ways. And of course, prior to having medication, treatment facilities, there was a generation that used alcohol in order to help manage, things. So people are using different substances, and there definitely is an increase in being able to support those individuals. I know vaping, of course, is on the rise, and access to other things that people can use that might be legal or not, that they're still doing those things. And there needs to be somebody there to help support that. And you can work in human services. You can work in a hospital. You can work in residential facilities as well. Okay, so now you're talking about a 4-year commitment with a bachelor's degree. And a lot of people use psychology and try and, kind of, find their way with psychology. And some people know they want to go directly into the field. So the social work and the human services might be an option. And I'm not saying what's stronger or not. The social work comes with the licensure, opposed to the psychologist, then maybe not. Maybe have that, or human services. But there's courses that you're going to probably take in order to help support you. And what does that possibly look like? Case manager, a care coordinator, the social worker is going to have a little bit more flexibility, and the mental health technician, and then a behavioral health specialist. I have seen the rise of behavioral health specialists, especially in K through 12 population. I look for somebody to really focus on what's going on from a behavior standpoint and being able to service those students. And you're going to be doing intake, you're going to be doing group facilitations, evidence-based behavior plans, check-ins. You're going to be in meetings that's going to include multiple people, from the psychiatrist to the psychologist to the admin. In a high school setting, it could be special education workers. It can be people who are used to dealing with IEPs, or even 504s as well, based on people's accommodations and things of that nature. All righty. And you see the pay there ranges, and we'll talk a little bit about the pay. I think this is a good average, but I had mentioned before about the opportunity. How can you leverage what degree you have, and what can you do? There are certain things at a certain level in respects to licensure or not, where you can deal with court reported people, which you could be a bachelor's degree, not necessarily in mental health, that you can do parenting classes, anger management, theft prevention, people who have maybe shoplifted and they need to do a certain amount of hours around that, parenting, as I mentioned. So there are some ways to do some court reported things, and as well as doing evaluations. I have the ability to do immigration evaluations. I can do evaluation for somebody having a surgery and they need to be assessed before they do that. So there's different ways outside of a traditional setting that you can leverage, whether you want to do that only or start your own business. You could be a contract person and you could just do that, or you can have it as an additional income. So I just want you to continue to think about other ways to leverage whatever job that you're in. The master's degree, I have the LPC, as I mentioned, and then you have your licensed clinical social worker, marriage and family therapist, and I have a lot of friends who are marriage and family, and then you have a school counselor, as I mentioned. You could be a school counselor and not have an LPC. The LPC, again, gives you the opportunity to go outside of the school setting and get into private practice, or see people for therapy individually. Psychiatric mental health nurse practitioner, that you can do that, as well as clinical psychologist. Just one thing to note, just that psychiatrist is a person that's, for the most part, in some states, they will give a prescription or give prescription or be able to give medication. They have to be a doctor. So usually it's a nurse practitioner. And some of you guys might have seen going to the doctor, APA, a physician's assistant. They can be a physician assistant with a mental health focus. So just like a nurse can be a nurse with a mental health focus as well. So that's another flexibility that they have within their degree pathway to do a deeper dive into something they're a little bit more passionate about instead of being a generalist. And then a doctoral level, that was a PhD in psychology, a Psych D, which is more of a practitioner kind of approach. And then I mentioned a psychiatrist. Psychiatrist is probably in the highest demand. I do understand that that's the longest pathway just because of the schooling that is involved. So that's something to think about. Is there a way for me to do something to that degree, but maybe I don't have to spend that much time in school if that is of concern? But definitely there is a monetary difference in being a doctor, a psychiatrist, opposed to somebody just with a PhD or a Psych D. It is a difference. And this is the salary snapshot that we just kind of went over individually by levels. And then I want to just do a slide on where you would work and how does that look, and kind of infuse that a little bit as we were talking. It's becoming more and more a remote field. A lot of people are doing remote. It's more flexible. I typically use it as a backup in case there's a for us, a snowstorm or something like that, or somebody, just can't get there they don't have a babysitter for the kids, and we can hop on and do something online. But I typically meet everybody in person. One of the things that's been changing within the field has been the counseling compact, which gives the ability for counselors, mental health professionals, to be able to go across state lines and be able to see clients outside of the state. Typically, you had to have a licensure within that particular state in order to do that. But in the past few years, more and more states have jumped onto this compact where they'll let you use your qualifications in their particular state, which gives you more of a range to be able to see more people. So that's another opportunity to have a steady income if you're kind of doing some contracting on your own. If you want to supplement it, now you can go outside the state. One of the concerns is that if you open up your state, then that means people can come from out and come in, as well. So some people were hesitant in doing that. I believe Michigan has almost completed everything to be at that point. All right. And then that's again something that's like which path is right for you. Like what level, what do you want to be doing? What do you want it to look like? Those particular things. So just want to leave you with some questions to ask yourself. Are you passionate about community and that thing? Then community health worker might be, or social worker might be the best. For me, it was school because I like the school environment as a teacher and would love to try and address some of the other things besides just academics or grade point average, things that impacting those particular things. So that's why for me, I want to do a school counselor, but I thought social worker would be it because I was still in the military at the time. So I was thinking about being a social worker in the military. So that's what I was thinking about that. All right. And I just want to give you some next steps. I know, again, I talked about being able to do a deeper dive and figure out and touch things. One of the things you can do is do a volunteer shadow. I will say this, professionals love talking about what they do, so that can be easy. Maybe it's a phone call, maybe you have LinkedIn and you want to connect with somebody and have some questions for them, but doing a shadow is great. Take psychology in high school. Typically high schools have them. AP Psych is a great class to take as well if you get to that point and want to want something a little bit more rigorous. And then research your state's licensure. I mentioned quite a few ways to work in the mental health field. It is multiple licensures in order to do that. So maybe exploring that and what it looks like. I know for me, I have to do a certain amount of, initially I have a limited license when I got finished. And that means you have to work for 2 years. I think you can do 3,000 hours of supervision where somebody is meeting with me that we met for once every 2 weeks for 2 years with somebody. in order to be able to have conversations about what we're doing in our jobs. And if we need some insight, I still have supervision as a contract therapist. So I talk to somebody about what's going on, what's happening. I got a difficult case, things of that nature. So some of those things have to be completed as well. So it's almost like a student teach. So I had to have a certain amount of hours while I was in the program as well. They videotape it and they critique you on, you know, how you're saying things, how you present physically, things of that nature. Explore community college pathways. Always, you know, we talked about an early entry into the field, maybe going to the community college and doing that, taking your psychology requirements if you want to do that. I know at Henry Ford, they have like a mental health. So it's like, you know, you're taking some of the courses that you would need for possibly social work or counseling or things of that nature. Talk to people in the field, talk to people in the field and take care of your own mental health, you know, as well. And then I just had some resources in respects to where you can find more information. So I just had this here. So that means career research, professional associations. We have many of them. I'm in a counseling one. I'm in the American Counseling Association. I'm in the School Counseling Association. I'm in the state association. So different ways to get information to stay on the cutting edge of your profession. And again, no matter what you choose to do, is going to be important. So mental health education and support. SAMHSA is a big one, and NAMI is around mental health, you know, as well. Licensure and certification. That's something to look into as well. Michigan LAR is our licensing body where we have to get our license renewed. And I believe the only thing, some people have to do training or something like that to keep it up. And they do ask you about your record. You know, they'll ask you a question about your criminal record, you know, every time that you renew. All right. The most beautiful thing we can do is to take pain and turn it into purpose. The field needs you. And if you have any questions, curiosities, and anything that you want to, you know, ask, I am open to it. I put a QR code there. That is for the whole presentation as a PDF. So you have some information to kind of go back to if you want to get to some information that you want to use.